This is a specimen of spleen. Spleen is a lymphatic organ and it is a part of the reticuloendothelial system. Now, first of all, the situation or the location of the spleen. Spleen is situated in the left hypochondrium, that is in the upper and left aspect of the abdomen, in between the diaphragm and the stomach. The spleen is located posteriorly in relation to the 9, 10, 11 ribs and around 4 centimeter away from the mid-dorsal line. So this is the anatomical position of the spleen. The medial end should be directed posteriorly and the lateral end should be directed anteriorly, and posteriorly the spleen is related to the 9, 10 and 11 ribs, and the axis of the spleen coincide with the 10th rib. Now come to the measurements of the spleen. Regarding the measurements of the spleen, spleen is around 5 inches in length, then 3 inches in breadth and 1 inches in thickness, and the weight of the spleen is around 150 gram, that is 7 ounces. Now there is a popular term called Harris dictum of odd numbers for the spleen. That means the spleen is related to the numbers 1, 3, 5, 7 and 9 and 11. The 1, 3, 5 are the measurements of the spleen in inches. Then the 7 is the weight of the spleen in ounces, and 9 and 11 are the ribs to which the spleen is related. Only the number 10 should be remembered because the axis of the spleen passes through the 10th rib. Before going to the presenting parts, let me explain the axis of the spleen. The spleen is related posteriorly to the 9, 10 and 11 ribs. Consider these 3 fingers as the 9, 10 and 11 ribs. The spleen is related like this, and the axis of the spleen will coincide with the direction of the 10th rib. So that is about the axis of the spleen. Now come to the presenting parts of the spleen. The spleen has 3 borders. So this is the superior border, this is the intermediate border, and below this is the inferior border. Then it has 2 surfaces, one externally, this is the diaphragmatic surface, and one internally, this is the visceral surface. And it has 2 ends, this is the medial end and this is the lateral end, and it has 2 angles, this is the anterior angle and this is the posterior angle. Now come to the borders. This is the superior border. The superior border is usually showing a notch in the lateral part, but here the notch is absent. But if you see in this spleen, this is another spleen. So here you can see this is the superior border. The superior border showing some notches. So these notches represent that the spleen is lobulated in development. So this is a superior border having notches. Now come to the intermediate border. This is the intermediate border. Due to the presence of the intermediate border, the visceral surface is divided into upper and lower parts, having different impressions. Now come to the intermediate border. This is the intermediate border. Due to the presence of the intermediate border, the visceral surface of the spleen is divided into here the upper and the lower part, and below this is the inferior border. Now come to the surfaces of the spleen. So this is the diaphragmatic surface. As the name suggests, it is diaphragmatic surface, so it is related to the diaphragm along with the 9, 10 and 11 ribs. Now on the diaphragmatic surface of the spleen, it is related posteriorly to the diaphragm, and behind the diaphragm there will be the left lung and pleura, and further behind there will be the 9, 10 and 11 ribs. Now come to the visceral surface of the spleen. So this is the visceral surface of the spleen. In the visceral surface, in the upper part there is a big impression. This one, this is for the fundus of the stomach. So this is the gastric impression of the spleen. And this is the intermediate border. Below the intermediate border there is another depression. So this impression is for the kidney. So this is the renal impression. And nearby the hilum, and this is the hilum of the spleen. Nearby the hilum, this area will be related to the tail of the pancreas. And this portion nearby the lateral end of the spleen. So this portion of the visceral surface will be related to the left colic flexor. So regarding the visceral surface, the upper impression will be for the stomach, the lower impression will be for the kidney, then nearby the hilum, this is for the pancreas, and further laterally this portion will be for the left colic flexor. Now come to the ligaments of the spleen. Basically the spleen has two ligaments, gastrosplenic ligament and the linorenal ligament, and they will attach along the hilum. This is the hilum of the spleen, this is the hilum of the spleen, and these are the ligaments. The hilum has an anterior lip and a posterior lip, or you can say that it has an upper lip and a lower lip. The upper lip of the hilum will give attachment to the gastrosplenic ligament, and the lower lip of the hilum will give attachment to the linorenal ligament. In addition to the gastrosplenic and the linorenal ligament, two other ligaments are also present. One of them is the extension of the gastrosplenic ligament, and it will be attached to the diaphragm. That is known as the phrenicosplenic ligament, or also known as linophrenic ligament. And the other ligament is present nearby the anterior or the lateral end of the spleen. It extends from the left colic flexor to the diaphragm. That is also known as the colicophrenic ligament. That colicophrenic ligament will support the spleen from below. That's why that colicophrenic ligament is also known as the sustentaculum linis. The phrenicosplenic ligament also helps in suspension of the spleen from above. That's why that ligament is also known as the suspensory ligament of the spleen. So this is all about the ligaments of the spleen. Now come to the arterial supply of the spleen. Spleen is supplied by splenic artery, which is a branch of the celiac trunk. The splenic artery, it runs along the superior border of the pancreas to reach the hilum of the spleen. It is tortuous during its course because there is expansion of the stomach, and to allow that expansion it is tortuous, and also by this tortuosity it maintains the blood flow to the spleen. So this is all about the spleen.